Welcome to Hebe Medicare Cyprus podcast, where science meets artistry and where doctors become true innovators in aesthetic medicine. In this series, we host some of the most inspiring and accomplished doctors from around the world, professionals who open up about their journey, their expertise, and the exclusive insights behind their private protocols and professional secrets. Today, we are especially honored to welcome my friend Dr. Fares Salameh.
Thank you.
Who joined us all the way from Israel. Dr. Fares Salameh is specialized in dermatologist and he's recognized and respected worldwide, trained hundreds of doctors in his career. In this episode, Dr. Fares Salameh is going to share with us his experience and perspectives on PLLA biostimulators and PRP treatments, as well as his secrets and philosophies in the aesthetic medicine field. So, stay with us until the end to explore his knowledge about the world of aesthetic medicine. So, welcome. I'm very happy to have you here with us. It's not your first time.
That's true.
In Cyprus, in our education center.
Yes, and it's always a pleasure and exciting to be with you, Emilie, again and again.
Thank you so much. It's a real honor for us that you came here again to train our community of doctors. So let's start, Dr. Fares. Please tell us a little bit about yourself, about your professional backgrounds and the different areas you work in.
Actually, I have made my specialization in Israel in one of the largest hospitals in the country. And there I started to specialize also in dermatology, but also in wound healing. Okay, this subjects always catched me up, and I wanted to know how we can regenerate our tissue and we heal wounds that are very hard and chronic to heal. And after finishing my specialization, I started also to be attracted to all kind of devices, machinery, the science behind lasers and all kind of devices to heal the skin. So it attracted me to the field of aesthetic medicine, and from there it all started because all the subjects were focusing into one thing, which is regenerative medicine and how to heal our skin and our tissue.
I'm curious, why dermatologist and why aesthetic medicine? I mean, what drew you to those areas?
Dermatology is one of the most unique and beautiful subjects in medicine because you can treat there all the patients that you want, from little babies till patients that are geriatric in their 90s, and you can communicate with your patients always. And there are also some other subjects because it's have a lot of variations. You can be interested in rejuvenation. You can be interested in skin cancer, and you can be interested in immunological problems from the skin. So it's very variable. It's very colorful, and you can specialize and go wherever you want in this field. That's why it caught me.
Amazing. So you came here this week to deliver 2 sessions of trainings on different fields. The first one is polylactic acid, the PLLA biostimulator, and the second one is PRP approaches, techniques, and protocols for hair restoration and for skin rejuvenation. So let's talk about those 2 topics. And let's begin with the science behind PRP. So my first question is, how exactly did PRP evolve from medical use, like orthopedics or wound healings, to aesthetics and hair restoration treatments?
Actually, we know PRP treatment since maybe the 70s, where actually it started as treatment for surgical fields. And in the past 10 years, we see a lot of studies and papers written about aesthetic medicine. And the reason is that the platelets, PRP is platelet-rich plasma. So platelets, they are like a warehouse or a factory of growth factors.
Amazing.
They secrete more than 15 different growth factors which induce and stimulate angiogenesis and wound healing and inflammatory response. So these three things are in common in a lot of diseases and also in aesthetic medicine when we want to regenerate the tissue. And since 10 years ago, so it entered the field of alopecia and treating the hair loss. It entered the field of scar treatment, the field of combination with the fat graft, and also even treating stria for after pregnancy and all kinds of.
And even producing exosomes from.
Yes, this is the newest field that I'm working about.
Let's keep it for later.
Yes, maybe we'll speak about it later.
Okay, good. So tell me exactly, how does PRP work in simple terms? How does it activate the follicles you have in your scalp or the skin rejuvenation? Okay.
Actually, I've said before that platelets have a lot of growth factors inside. This growth factor are released when the platelets are injected to the tissue. If it is the scalp or in the face, it is released. Actually, in 1 hour, all the growth factors are already released, and they induce the synthesis of proteins and induce the hair follicle to rebuild itself. This is the way.
So
growth factor.
immediately in the first hour after injection, the work is starting to be done.
Yes. Yes.
Amazing. And how many sessions do we usually need, and what reasonable results can we expect to achieve and see in our eyes?
Usually, the treatment of PRP is very close to the treatment of other medication, where we have the induction phase when we need to do a lot of treatments close together. For example, for treating alopecia, we need one treatment once in a month for 3 or 4 sessions, and afterwards we need the maintenance period, which is 1.5 years, because think about it, the alopecia process is a continuous process. It's not like a pneumonia or a acute problem that you can fix it and that's it. It's something continuous. So you need to make a continuous treatment.
So actually, in simple words, you mean that in order to maintain the results, we need to make a touch-up.
Yes, touch-up or
by
maintenance.
The recommendation of the doctor. So if you respect your next appointment and you come for your touch-up, you will have long-lasting results.
Yes, actually, I tell my patients, if you don't come to 3 or 4 sessions, don't come at all, because you won't see results from one session. It's pity.
So another interesting question that I've been asking myself as well. You know, some of us were drinking alcohol, maybe caffeine during the day. Some of us are smoking. So one of the myths that many of us have in our head is, what will be the quality of my plasma? I mean, how important is the patient's own blood quality in achieving good outcomes?
Okay, there are two fields to make a response for this question. First of all, the count of the platelets really counts, okay? Because if you have, for example, just 150,000 platelets per milliliter in your blood, it's quite low. Someone will have 500,000. It may be much more platelets, and it will be much more effective. So this is one thing.
This will also change the quality of the plasma?
It will change the dosage of the growth factors that you have when you inject. And the other thing is how much you are healthy. If you are healthy, so your blood is healthy, your platelets are healthy and more active, and it's good to be healthy. Also because the PRP will be much better quality.
How will you know in advance?
Actually, you don't have to know, because you don't have to. You can't do anything about it. But that's why when I do PRP, and I can't change the person's blood. I take what's there, but I always combine the PRP with another treatments to enhance the treatment results.
Like what? Give me.
Okay, and these enhancements are not built on his blood. For example, I use industrialized growth factors, for example, the AQ products of Dr. Al-Qahtani, because these products have their own growth factors, and there is no question if the factors are in good concentration or bad concentration, like the blood. The count can be low or high. There, you are giving him the right dosage, and in this case, you can a little bit, if there is a problem with the blood, so the AQ products will give you the benefit of the growth factors that you put.
We'll close the gap.
Yes,
If there is any.
Yes. This is the idea.
Mm-hmm. Okay, interesting. Tell me in a sentence, how does PRP different from stem cells therapy or exosomes treatment?
Okay. First of all, PRP can be injected. Okay. And for exosomes and stem cells, there's a lot of regulation that refrain you from injecting them. Actually, you can't inject in any country's exosome except autologous exosomes. And most of the exosomes that are you can buy from different countries are not autologous exosomes. That means that you can't inject them. You just can put them topically. Mm-hmm. And there are a lot of questions about topical usage of exosome, because you don't know how much of the exosome is entering the skin, and how and what is actually it's doing. It's compatible with our cell machinery. Does the body accept them or not? So this is one question. Stem cells are also till now you can't just inject stem cells to the scalp, and it's also topical. So there's also a question about how much of the growth factors are getting to the cells. Exosomes are not built on technology is not built on growth factors. It's built on RNA and messenger RNA. So it's a different issue, but as I said before, if it's not autologous, you cannot inject it. PRP is injected and brought exactly to the place you want.
My next question is regarding the tubes that we are using for the PRP. So can you explain the difference between various options of tubes, different sizes, different anticoagulant materials inside, different prices in the market, different companies, different brands? How would you know to choose the best tube for your client, and what do you want to achieve as a result in your plasma?
First of all, I thank you for this question, because I think it's very, very important question. In my country, and I'm sure that in other countries, there are a lot of doctors using diagnostic tubes. Diagnostic tubes are the regular tubes that are used in a laboratory.
You buy them in the pharmacy,
yes,
very cheap.
You can buy like a big sack of tubes.
Do they contain any separation gel?
Most of them not, but some of them yes.
Okay.
You can find also some of them that will have separation gel, but they are not built for PRP. They are built for that blood to be put in, not taken out. Okay, so there is a big issue of sterility and regulation, that you are using something not allowed to be used in this indication. This is one thing.
So they are not allowed to be used for injection at the end?
Yes, because it's not built for this this
so
reason.
You can take blood to those tubes, but they are not safe.
It's not
taking
safe.
the blood out and inject them back in.
It's, you can do it on your own responsibility, but it's not something you should do. This is the first thing. It's regulatory. It's also logical, not logical to do something like that. But there is also another thing, which is the effectiveness of the treatment. I have checked in my hospital. I have made some examination. I took my blood. I put it in 2 tubes. One is the designated PRP tubes, like the ones that we see here, the Swiss ones. and I put the other sample in a diagnostic tube. And when I make the centrifugation and prepare the material, I send it to the lab to have the counts of the platelets. And I saw that the diagnostic tube did not concentrate the platelets. The platelets in the blood, the peripheral blood, and the platelets inside the diagnostic tube were the same or even a little bit less in the diagnostic tube, while the count in the PRP, the PRP tubes
In the PRP
were
tubes, for example,
3
12
times more.
ml, 9 ml.
It's 15,
Both
it's
This
12,
one is the
12,
12,
12
yeah.
ml.
Three-
But you can find also bigger tubes. But the important thing, it concentrated my platelets. Okay, so when I inject them, I inject concentrated platelets and not just the same count of platelets that is found in the peripheral blood. This is also one thing. The other thing is the type of anticoagulants that inside the tube.
Exactly.
You need an anticoagulant that is not affecting the platelets themselves, changing their structure or making them clot together like heparin do. So sodium dextrose is one of the best ones, and we can find it here. And the third thing is the separating gel, which should be good one, and making a good separation between the red blood cells and the plasma, and not just holding the platelets inside of the gel. So these are all important things, and I advise all of the doctors to buy just designated PRP tubes, not to have the cheap ones that don't give your patients an effect.
Good, thank you. So, are there any pre-treatments or post-treatments recommendations that will make any difference?
Pre-treatments, there's nothing special to do, but post-treatment, I advise my patients, first of all, not to wash their head for 6 hours. And why I tell them that? Because I put topically the growth factor, so I want them to be entered into the scalp and not be removed by water. I advise them not to do sport, or physical activity for 2 days, because I don't want them to sweat and maybe cause an infection in the scalp. Otherwise, and also not to go to pools or sea water in 2 days until the punctures of the injection are healed. Sometimes we can also use some products which are including PRP, like the one you have in Hebe.
The Salameh cream.
Salameh cream.
For the face.
Yes, and because it also holds a growth factor inside, and people can put them, 1 week to 2 weeks after treatment, and in this way maintaining the results and having more push to the
It's nice because
follicles.
it's customized. I mean,
yes,
like
it's
with
from,
your own PLP.
Yes, it's
But
from the
it's
same
customized only for you.
for you, and it works for a lot of time. That can do it at home.
Good. Can you share with us memorable success story?
Actually, I remember a couple of years ago when I started doing PRP, I was a little bit how do you say?
Skeptical, maybe.
Yes, skeptical. As I always do that with any new era that I'm or thing or machine that I'm starting to work with, and there was a famous doctor that came to me to do the treatment, female doctor, and I didn't know how much to be comfortable with my feelings for that. But actually, when I started to do the third, fourth treatment, there was an amazing transformation of her hair.
Really?
She had a very severe female pattern alopecia, and her hair density grew very, very fast, and it was impressive. And even she told me something that until this day I remember, that she told me that her hair became a little bit curly.
Curly?
Yes, like she was when she was 15 years ago.
Wow.
She says, my hair, I remember it like this when I was young. And this emphasized the regenerative power
Yes.
of this treatment.
This is an amazing story.
Yeah. So when I saw that, I thought, okay, this is a good treatment, and I'm going to give it to my patient for all the alopecia that it will respond to this treatment with confidence, and try also to enhance it with all the other materials
other
that exist.
That you combine with. Wonderful. Tell me, please, what are the real risks or side effects, if any?
Theoretically, at every injection, there is a side effect, can be a side effect of infection, okay? But I tell you, I have done hundreds of PRP treatments. I have never seen such a side effect. And the first reason is that also I try to work clean and septic work with, cleaning the scalp, but also the scalp is have a very high blood supply. And when you have a very high blood supply, the ratio of infection is very low. So I didn't see any side effects except pain for 1 or 2 days.
Of course.
Yes,
Yeah.
but nothing.
Reasonable.
Not.
And if we're talking about
something
face PRP, face, neck, décolleté, will there be any risks?
Also, there are the same risks, of infection or hematomas, because in the face you can see the hematomas and the bleeding in the scalp. It's not so obvious, but these are minor things, and people that just can put a little makeup and hide it for a couple of days until it resolves by itself.
Okay, good. So, speaking of regenerative aesthetics, let's move on to our next topic, the PLLA biostimulator, polylactic acid products. So, for those who are new to the concept of PLLA biostimulators, what exactly is PLLA and how does it work within the skin?
Okay. PLLA actually is one of the products of the new era, which is called the regenerative medicine era or regenerative aesthetic era. And it's called a biostimulator. Biostimulator is a product that is injected to the skin, and it causes some effect or an action from the tissue that it's injected to. And this action is produced by some kind of inflammatory response, which is usually mild, giving rise to stimulation for collagen production or any other effect, which is regenerative effect. So this is biostimulator. It causes our biology to respond and be stimulated.
And how come polylactic acid is different from other biostimulators in the market?
Okay, this is a good question. It's a little bit complicated, but the most important thing is the size of the particles, okay, and how they interact with the tissue. As a rule of thumb, when the particles are sphere and smoother, they will give much more tolerable interaction, much better interaction with less side effects. And this is one of the major things in PLLA, in Spella, for example, because it makes an interaction which causes the production of collagen without having a very harsh inflammatory response of foreign body, okay? And this is the most important thing. The structure and the shape of the particles. This is what unique every biostimulator from each other.
Interesting. And talking about our product Aspella, what are the benefits of using Aspella? Why is Aspella the smarter choice for polylactic acid products comparing to other options in the market?
As I said before, it's particle size, particle shape, the smoothness of the particles. Other particles can be much bigger or have a rough surface, so they will lead to a much more intensive inflammatory response with more side effects like granuloma and nodules and things like that.
Will it also be more painful?
The injection itself is it's not painful, but but you fear the bad responses, the bad immune responses. That's why we don't inject, for example, sand or any other foreign body, because we need the foreign body to act in a special way with the immune system, leading it to stimulate collagen production, not making fibrosis like scars and big nodules that can be destructive to our face. And Spela just uses the right size and shape of particles, and this give us nice results without the fear of all the bad side effects, and also longevity. It works for a lot of time, more than 25 months.
More than 25 months.
Yes.
And what is the protocol? I mean, how many sessions do we need to do in order to see the final results?
It's very advisable to do 2 to 3 sessions, 1 month apart, and this can hold for something like 2.5 years. A lot of my patients see a little bit of change after 1.5 years, and they don't want to wait until the material goes.
So they come after another session.
Yes, after 1.5 years, they usually come to a maintenance session.
Will I, as a physician, be able to inject the Aspela in other areas except of face?
Yes, actually, Aspela is one of the PLLA products that indicated for other places like the neck, décolleté, the upper arms, the back of the hands, and also I injected a lot of times to the belly, to the skin of the belly.
What will I see?
When the skin of the belly is very thin and wrinkled, it can give the skin more structure, and it will be much more firm. So I usually combine it with even energy-based devices like fractional RF and other devices to give more structure to the loose skin of the belly.
This is very interesting to hear.
Yeah, it's very nice.
Very, very nice. So let's settle this once and for all. Please, how do I dilute the product? Water for injections or saline? I've heard so many concepts and so many theories, and I would like to know, for God, what's the right choice to use?
Okay, so I will tell you the last thing that you should, the bottom line. Okay, bottom line, use water for injection, because this is the instruction of the producer. But I should say that a lot of people use also saline. What's the difference between water for injection and saline is the salt, NaCl, And probably there's a difference in the hydration of the vial if you use water for injection or use NaCl, because the water for injection or NaCl hydrates actually the component that is called CMC, carboxymethylcellulose. The carboxymethylcellulose, when you fill in the water for injection or saline, they absorb the water, they become larger, and they keep the particles of the PLLA apart, because PLLA is a lipophilic material. That means that if you have it alone in the vial, you can't dissolve it. You can't. It's undissolvable. That's why you use a CMC, and probably the CMC is better reacting to water for injection than saline.
I understand. If a doctor is using saline, it's not that he's doing something wrong.
No.
Just your command.
The use of water for injection, like the producer of the material. This is instruction.
Exactly.
I also need to say that there's one big study that was published using NaCl, and it was found that it's safe. So you have, let's say, medical evidence that supports also the use of saline, although it's not very common to do that.
Thank you for clarifying that. Thank you.
Welcome.
Okay. So let's say a patient walks into your clinic for consultation. How would you recognize that this is the right candidate for the PLLA biostimulator product and not other options that you have in your clinic?
Okay, first of all, nowadays we should look at the patient in a holistic point of view, not on the deflation itself, not on the pigmentation itself. You should look at all the face as
Holistic approach.
holistic approach and in harmony. And I can say that patients after the age of 35 to 40, the amount of collagen is reduced because we after the age of 25 we use 1% of our collagen each year, and at the age of 40 45 25% of our collagen is gone. So if a patient is 35 45 years old, his collagen is reduced, and the PLLA will be always a good choice to give him more collagen and more structural building of the skin. Afterwards, you can also look and combine the PLLA with other things that you see in the face. For example, if you see that there is deflation in the cheeks, you can also give him fillers. If you see that there are a lot of wrinkling and sun-damaged skin, you can use devices also like non-ablative fractional laser or CO2 laser to fix this problem.
Will the fillers hold different or longer in the face after you injected first the PLLA?
The patient will feel that it's longer, but actually what is happening that the fillers, the HA fillers will work instantly, and the PLLA will work start working after 4 months until 2 years. So for the patient is not thinking so much deeply about the differences in the material, but he will feel better for longer time.
Can you inject them in the same session, or you need to wait a while?
I don't inject them in the same session because PLLA have a lot of water inside, and sometimes there's a risk of having more edema. I usually start with filler. I fix the deflation, the volume deflation, and after just 2 weeks, 3 weeks, I can inject the PLLA for longevity and for building the skin.
Very nice. Thank you. Can you give us any golden rules for new doctors who are entering the field of PRP or PLLA products?
I think that this era of medicine needs that you have to be open-minded and have a global picture of the patient's face. So these treatments, especially the PLLA, are not for a fixed small problem. They are general treatment for general rejuvenation for the patient, and you should always start from this point, not from the small points of deflation or any unique small problem.
Okay. Another question that was interesting for me. Can there be any bad results from PLLA products, like side effects, or maybe sometimes my skin can reject the product, the inflammation that we want?
Actually, large studies have shown that the side effects are very low. For example, nodules or granulomas, which are the immune system reaction for the product, is less than 0.4%. Okay, so it's very, very low. But it depends on how do you do the treatment. Okay, the doctor element of how is reconstitution of the water, dilution of the product, and where to inject it and at which depth is very crucial for preventing side effects. And also, you should know that if you inject the material in the wrong area, for example, in the frontal area, around the eyes, around the mouth, which are very dynamic areas. These are no zone areas. You should refrain from doing that. And even in the yes zone areas, for example, if you put a lot of material in the jowl, okay, it's not a no zone area, but it's jowl. And if someone is having a sagging here and you inject him more, so you'll have a bad result. You will make his face heavy. That's why today we are going to speak about the protocols and how to do it right.
Where not to
Where
inject.
not to inject. How to tailor your treatment according to the face of your patient.
Yes.
It's not a fixed treatment for everybody. You know,
Right.
you should look, analyze,
and
you should
then choose the
choose-
entering points, the
Yes.
areas of injection.
yes, and how much volume of the product you put in each place.
And how much do you want to dilute it?
Yes.
8 ml, 10 ml, 12 ml.
Yes.
Is it also connected to how you analyze your clients?
Yes, it's. I say globally, generally, in the face, I dilute it by something like 10 ml. Outside the off face, I dilute it something like between 12 and 20 ml.
You mean for body?
Body. It should be much more dilution.
So, Dr. Fares, for the closure, just a little bit from your very, very interesting personality, because you're my friend and I've known you for a long time now, more than a year, let's say.
Yes.
Please share with us, what gives you the greatest sense of fulfillment in your work? The moment when you see and you know you've truly made a difference for someone's life.
Yes, I really enjoy my work. First of all, I enjoy my work in dermatology. I enjoy my work in aesthetic medicine. But I really enjoy it when a patient comes to my office with some problems in her face and I fix the problems, and she says to me after finishing the process that she is feeling very comfortable with herself, that she's accepting herself much more, and she's feeling much better, and she's fulfilling herself. And this is usually happens when you treat the patients with things that make a natural result. And this is the main issue about PLLA. PLLA doesn't give you a large volumes and large changes in the architecture of the face. It gives you very natural and younger look without such a very, very big change in volume. And this is all the women like, and all the women seek such a result.
I believe that, taking what you said even one step forward, that exactly when a patient, when a client feels good with himself, so it brings his confidence out, and he can perform in different areas in his life much better because he feels good with himself.
Exactly.
He's more calm, he's more satisfied, he feels like more secure, self-esteem is higher.
Yes, he can enjoy life better.
Yes.
Yeah.
Yes.
He have more confidence to enjoy life than sitting and closed in himself.
Yeah. So this is the highlight of your work,
Yes.
making people achieve their dreams because they are having more confidence and they feel better.
Being a better version of themselves.
Yes,
This is
exactly.
the word.
It's starting from the outside to the inside.
Yes.
Sometimes it goes the other way around, but you can definitely start with feeling good of how you look, and it's bring all your confidence out to follow
Yes.
your goals and dreams.
Exactly.
Thank you so much.
You're welcome.
For
It's always a
being
pleasure.
here with us. And we're waiting for the sessions to start now.
Yes. It will be a very, very nice evening today.
Exciting day.
Yes.
Yes. Thank you.
Thank you so much.
So, if you're a doctor and you're interested in joining our community and learn more about the aesthetic medicine world, you can always follow up on Instagram and get information about our upcoming events. And if you're interested of hearing more about the PLLA, biostimulator, and the PRP approaches, you can look at our Instagram page and see parts of the sessions we'll be giving today and tomorrow by Dr. Fares Salameh. And if you're interested of learning more about the knowledge and the journey of Dr. Fares Salameh, you can find the link to his Instagram page in our podcast details. Thank you very much.